This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo. About a year ago, we brought you the story of Kim Kostka and her husband Phil. Kim was a longtime smoker who switched to vaping in her early 50s. It was a habit that gripped her for 2 years.
Because it's socially accepted, it's cleaner, anybody can get it, it's yummy. So 2 years too long.
Kim developed what doctors call EVALI. That's e-cigarette or vaping-associated lung injury. By the time she found out, it was almost too late. According to the Centers for Disease Control, cigarette smoking is estimated to cause more than 480,000 deaths per year in the United States. As compared to smoking, vaping is a recent phenomenon. But in early 2020, the stories and statistics began trickling in.
6 deaths are now connected to a growing public health crisis tied to vaping. The newest deaths.
1 year ago, the self-proclaimed vaping fanatic suffered a collapsed left lung.
Research papers focused on vaping and e-cigarettes. Doctors found the chemicals may hurt your heart, lungs, brain, blood vessels, gastrointestinal system, and other parts.
On October 15th, after doctors told his family death was imminent, Daniel was given a double lung transplant.
By February 2020, the CDC reported that vaping had been responsible for over 2,800 hospitalizations and 68 deaths nationwide. But soon, the COVID pandemic arrived, grabbing all the headlines. And after that, the epidemic of opioid overdose deaths. According to the Arizona Department of Health Services, over the last 5 years, 5 people have died each day in Arizona from opioid overdose. This is one possible reason why people just haven't been talking much about the dangers of vaping. In March of 2023, Kim Kostka was just moments from becoming another vape-related death. It had been a gradual decline, something no one noticed until her lungs were so damaged she became hypoxic. Her brain was starving for oxygen.
I remember she came out in the hallway one day and she said, "Hey, Phil, did you put the sand in the frames?" And I was like, what are you talking about? I have no idea what that means. And then she said, "Yeah, you got to circle it with blue for Instagram." And I'm like, I don't know what that even means.
Over a long period of probably a good 2 weeks, I just couldn't get oxygen, so everything was fuzzy, and then I died.
In the year since we first shared Kim's story, so many people have asked me, "How are they? Do you have any updates on them?" So this week on the program, we're catching up with Kim and Phil Kostka. They've been gracious enough to share their story again, and their updates, and they've given us permission to speak with a couple of the incredible physicians who cared for Kim. We're looking back at what Kim and Phil endured, and we're looking ahead to their future together. March 2023. After 2 years of vaping and 2 weeks of hypoxia, Kim had reached a critical state.
I went to bed and I could still hear her breathing, and she was really labored breathing. About an hour later, I felt her get out of bed, and so at that point it's about 3 o'clock in the morning, and she's wandering around in our living room area. She has no idea what she's doing, but I hear her kind of walking around, and nothing out of her mouth was making any sense. I heard one word, and she just said hot, and she was just profusely sweating. I'm like, I'm taking her to the hospital. I get her in the car, and her head's kind of nodding off, and I'm thinking, is she going to sleep or whatever? And I kept telling her, baby, you got to stay awake. You got to stay awake, So I get out to Stockton Hill, right around Northern, right where the light is. She just slumped forward in the seat and just died.
Definitely didn't meet Kim under the best circumstances.
That's Dr. Clarke Snodgrass.
I'm a emergency medicine physician here at Kingman Regional Medical Center. We saw a car just rapidly pull up into the ambulance bay. We also have a camera up there, and we could see a guy kind of frantically get out of the car.
Phil had pulled up to an ambulance in the parking lot.
I rolled down the window and I said, I need help. My wife's not breathing. Immediately, the door flew open. I don't know who that girl was. I don't know if she was paramedic or who she was, but pulled her out of the car and immediately started doing CPR. And from my understanding, there's a code that goes out in the hospital, and that type of situation happens.
So immediately Me and several of the nurses, a couple of the techs, we ran outside.
And it was like all hands on deck. Like, I don't know, it was like an army of people started coming out of the emergency room.
Definitely looked lifeless. Didn't feel a pulse. We decided to just lay her on the ground there and start our resuscitative efforts out there in the ambulance bay.
I mean, there was like 3 people, and then there was 5 people, and then there's 10 people. I mean, it just seemed like this army of people came out there and just trying to revive her, and it was at least 10 minutes where they were trying to do CPR right on the ground. I mean, it was just out on the ground, on the cement, just trying to revive her.
The most important thing with cardiac arrest is really starting high-quality compressions right away. And so we were able to insert a IV line out there. And the specific IV line that we put in actually is one that goes into the bone. And we do that because it's the quickest way to get access. And that way we're able to administer medications, specifically epinephrine. So yeah, epinephrine essentially causes vasoconstriction. A lot of times when people lose pulses, it can be for a variety of reasons, but essentially everything just gets lax, including all the vessels in the body. And the goal is that if you're going to do chest compressions, you want to give an agent that can make the vessels smaller. That way, when you're pushing the heart and it's ejecting blood out, you're getting blood into the coronary arteries and hopefully up to the brain. So we had given her a dose of epinephrine. And during the 3 rounds of compressions, we're kind of organizing how we're going to safely get her inside and do this in the most efficient manner where we're not taking breaks from doing chest compressions. So on one of our pulse checks, we were able to roll her and get her onto a backboard. And then we resumed compressions for another 2 minutes. While those compressions were going on, we got the bed lined up next to her. I just discussed the plan as soon as it's a pulse check, we're going to lift this, we're going to get her onto the stretcher. So we did that. And one of our techs actually got up and straddled her and continued chest compressions while we moved her inside. And then once we got into the resuscitation bay, which is a lot more familiar for us, we have a lot more access to different devices and adjuncts that can help us. We did one more round of compressions and we got pulses back on her. This is essentially the ideal scenario, right? And maybe not the most ideal setting. But there were a couple things for Kim that gave her a good advantage. And one of these was knowing that she likely lost her pulses right before, her husband got her to the ER. And, I was asking him, like, kind of during all this, I'm trying to get some history from him. And he's actually very calm and cool.
And they said, how long is she without oxygen? I'm estimating probably 4 minutes,
One of the big things that stuck with me is that he had been saying that she had been vaping a lot and that she was just on him all day. That kind of told us it's, primary, likely a lung problem that's causing this. She didn't have any other significant health issues as far as like heart disease or anything like that. And she's a younger lady that was in good shape. So some of those things worked out in her favor.
In the emergency room, they take you to what's called the quiet room, because it makes it easier to not see what they're going to be doing. So I'm sitting in a room just, by myself, just wondering, what the heck is going on? Like, how is this even happening? And there was a couple nurses that came in, and they kind of console you a little bit because, they trying to calm your nerves a little bit.
So once we got pulses back, it's not uncommon for patients to have very low blood pressures. We start them on medications, kind of like epinephrine, that help keep the blood pressure up. And our goal is really to just perfuse the organs. We end up having to insert advanced airways and put her on a ventilator. 1, to protect her airway, and 2 is so we can go ahead and get other testing done in the ER, to decide where she ultimately needs to go to. We ended up getting other imaging on her, essentially what we call a pan scan, where we do a CT scan of the head, neck, chest, abdomen, and pelvis. And what we saw in there was really significant pulmonary injuries. These injuries we call e-cigarette vaping-associated pulmonary lung injury. And there's not much to do in the acute period. It's really just like supporting the respiratory status and the hemodynamics of her.
He came in and he said, well, she's really not out of the woods. And I said, what do you mean? And he said, her lungs are in really bad shape. And I was like, from what? I don't understand what's happening.
Kind of explained to him what was going on. And then from there, it's, we chat with our colleagues up in the ICU, and it was Dr. Charran on that night, and she took over care for the patient.
My name is Dr. Ordessia Charran. I am a pulmonary and critical care medicine physician here at Kingman Regional Medical Center. When Kim first came in, she came in, of course, from the emergency room, who had done a great job resuscitating her. As, Kim and Phil told you, she was basically dead in the parking lot. They got her heart to restart. They got her intubated and on the ventilator. And she came up to the ICU in critical condition, where the ventilator or the breathing machine was delivering 100% oxygen to her lungs. She also was in a very, very bad position where she was in shock, which means her blood pressure was so low, we had to administer blood pressure medication to lift her blood pressure or raise it. Those are called vasopressors. She also had, on that first 2 days, evidence of liver injury and heart injury, all from just being without oxygen for a prolonged length of time. So a sort of rule of thumb that we have in critical care is for every organ system that's down, it's about a 20% chance mortality. So you have the lungs that are sick, the heart's a little sick, the liver's not so great. And then don't forget about the brain. We don't know if she's going to wake up after being without oxygen and getting CPR for so long. So that's about an 80% chance of mortality right there. So when I first saw her on the breathing machine, hearing what I'd heard, the story from the emergency room, and talking to Phil, I, almost immediately said, hey, we need to sit down and talk about what to do if this doesn't go well. Because there's a very high chance that she would not have walked out of there. And I think I told him that day. Hey, we need to talk about what if your wife doesn't come home? What is that going to look like?
They sent Kim in for a CT of her lungs, and then Dr. Charran put it up on the TV there. They have a big monitor up in the ICU. And she said, okay, so normal lung tissue on a CT appears black or dark. And Kim's were completely white. She asked me, does she vape?
On the day that she came up to the ICU, she had already had a CAT scan of her lungs, showing that her lungs were completely filled with inflammation. This is the reason she required such high support on the ventilator.
Dr. Charran, she said that she's on 100% life support at this point. Like, she's not even breathing on her own. The machine's doing all the work because her lungs had just stopped. And so she said she went into respiratory arrest and then cardiac arrest. She basically suffocated very slowly, and then the organs just started to shut down.
Once we were able to assess exactly what it was with the bronchoscopy, so when I went in there with a little camera into her lungs, it was completely filled with inflammation, meaning there was so much mucus in there, thick, frothy mucus that needed to be suctioned out. The airways themselves, like the bronchi, you can tell it was like a huge bruise. There were little dots of blood all over the airways, like if someone had punched you in your airways, just really damaged.
The ICU team performed what's called a bronchial wash. They suctioned the secretions from Kim's lungs.
When someone comes to the hospital in what's called cardiac or respiratory arrest, meaning their heart isn't pumping blood, that's really the main insult, because no amount of CPR can replicate how the actual heart pumps blood efficiently around the body. So even with good quality CPR, there is still a chance of having prolonged hypoxia or anoxic brain injury. And I think it was about 15 minutes that they were trying to resuscitate her. When I first see someone like that, nothing can tell you for sure. In the first 24 to 48 hours, you have no idea, is this person going to make it out of there? And if they do, will they wake up and be that person we once knew? Will they be able to walk? Will they be able to talk? Or are they just never going to wake up? Only time will tell. And that's the hardest thing to explain to people. When you come in, you bring your loved one in there, and we're like, hey, well, I guess we'll know more in 48 to 72 hours. And that's really when what we call neuroprognostication, that's really when that begins, after the initial insult.
If you're just joining us, this is Focus on Your Health. I'm TG LaFredo, and this week on the program, we're catching up with Kim and Phil Kostka. Kim had smoked for decades. Sometime around 2021, she switched to vaping, which almost killed her. Actually, it did kill her. In March of 2023, on a 3 a.m. race to Kingman Regional Medical Center, she slumped against the car door and died. The team at the emergency department was able to bring her back to life. She faced a long stay in intensive care, and it's been a long, slow journey back to health. But today,
I'm doing amazingly well. I am just doing so good. Thanks to my husband, number one, for getting me to the hospital quickly, and for all the doctors and the first responders and just everybody there. I still cry because I hear the side of my husband and my mother, and it breaks my heart that I put them through that for the stupidity of vaping. The stupidity of vaping. I'm 55 years old. What the heck is wrong with me for vaping?
Kim was extremely lucky. She had high quality CPR. She got resuscitated right when she needed it. She came up, and I think after 24 hours or 48 hours, we did a breathing trial and an awakening trial. That means we took off any sedation and pain medication she was on, and she woke up. She blinked her eye, she squeezed your hand, she was in there. And that's when you are just so encouraged, and you're like, we're going to keep on going, because you are in there and we're going to get you through this.
It is much easier today than it was the last time I visited you. I've had some neurological studies and a cognitive test, which I scored a 21 out of a 21. My brain scan came back normal for my age group. I'm not stuttering like I was. I am remembering bits and pieces of things. My PFT test was 100%, which means my lung capacity is 100%. I still have a lot of pain in my chest, but you know what? That's okay. What's pain? I'm alive.
Kim has also had to endure the psychological side of recovery. She struggled with frequent nightmares and night terrors.
Post-ICU PTSD is real.
People are traumatized from being in the intensive care unit. It's a very unnatural thing.
And I've never experienced something so vivid and horrible. And you can't wake up or open your eyes, and you have paralysis. Your mind just does really weird things. I still think when I close my eyes that, they took me to the basement and put me over a hearth of fire. And I can't sometimes wake up. I can't get a scream out. But I feel amazing. I'm lucky to be here to walk, talk, have cognitive ability. I'm lucky to put my own clothes on, to speak, to have memory. I'm just very blessed. I'm a 1% survivor because I didn't die one time. I died 8.
Toughest lady I know. Yeah.
I think overall, the prognosis for Kim moving forward is extremely good. And that's not everyone, but Kim has made such a great recovery because I think she's really put her mind to her physical therapy, her speech therapy, avoiding vaping, not going back to smoking. You'd be surprised how many people, they're intubated in the ICU or they get a lung cancer and they're still smoking. I had someone, it was their 3rd lung cancer, and they could not stop smoking.
When Kim was in a coma and Phil was at her side, he often reminded her she was about to become a grandmother. The family needed her.
If you ever have a loved one in a coma, just sit there and talk to them. Believe it or not, they hear you. Kim was just, she's so happy to be a grandma. Loves that baby more than anything. I'm just so grateful that she's here to experience that, because that would have been really hard by myself, I don't lie.
I love it. There's no love like being a grandparent.
Kim still sees Dr. Charran for follow-ups. And not long ago, Kim was able to meet up with Dr. Snodgrass.
One of my colleagues came up to me and was like, hey, there's this lady I'm taking care of over here, and she was asking if you're in the ER. And I was like, oh God, not always a good thing, And I think they kind of saw the look on my face, and they're like, no, they just really want to see you. She said you saved her life one time.
It really makes it feel like what we are doing in the ICU day in, day out, it makes it worth it. because there's so many times that, nurses and respiratory therapists would be like, what are we doing here? We're not making any difference. We don't know if they're going to make it or not. And then you can share these success stories.
It was great getting to have that experience because it's not something we get a lot of times in the ER. We don't get a ton of follow-up on patients.
Everything we do, every little thing that we do, whether it's how we do our sedation, whether it's how we place our IVs, how we choose what medications to use, what sequence we do things in, all these things matter because some people survive. And when they do survive, it made a huge difference to their long-term cognition if you were able to liberate them from the ventilator in a more aggressive manner, if you were able to do physical therapy in the ICU, if you were able to give them good nutrition in the ICU.
And for me, it was really cool because, she knows who I am, but she doesn't know she doesn't know me, So it was really great getting to have that experience and getting to chat with her.
For me, on a very personal note, there's nothing more rewarding than seeing a patient who comes in after you have done the best you could for them in the worst times of their life, to see them just walk in looking all beautiful, smiling, talking. Sometimes it's more than you can ask.
I asked Kim and Phil, after all they've been through, what's next for them?
Growing old together, traveling, enjoying that grandbaby, having my mother out here living now. We're just going to enjoy life because it's not promised to anybody. Tomorrow's not promised to anybody.
I think we learn to enjoy the simple things.
Very simple.
So we get up in the morning and we don't turn on TV because news will drive you crazy. But just to sit there, don't be on your phone, right? What do you want to do today, honey? Enjoy each other's company because, trust me, it can leave you pretty quick.
Here's another thing, honey. Since I've been able to recover more and more each day, we become sillier and sillier. We don't care about our karaoke when we do it. We do it in our house. We dance with each other, and Phil's not coordinated at all. Right? and we just don't care. It's just the two of us, and we're just so happy. I mean, he's twirling me, and we're dancing. He's got 2 left feet. We're just having fun.
Is it possible that one of the worst things that could ever happen to a person could somehow become something wonderful?
You know what? It is a positive because we lived the hustle and bustle of Vegas and the traffic, and now I don't want a new pair of shoes. I don't want a new purse. We're simplistic. It wasn't a good thing to die, but it makes you not take things for granted.
Anything you've done or said or, laughed with, it sticks with people. Because when the bad happens, everyone always thinks, it's the worst possible thing that could happen. But you know what? If you count how much good time you had in your life, I guarantee you it outweighs your bad tenfold. And if you look back and I look at all the good times we've had, have we had fights? Have we had arguments? Absolutely. Come on. Every couple does, right? The fact of the matter is that the good always outweigh the bad.
True that.
And that is Focus on Your Health. Like the medical care Kim received, this episode also required a team. I'd like to offer my deep gratitude to Dr. Adam Dawson, Medical Director of the Emergency Department at KRMC. Thank you, Dr. Clarke Snodgrass. Thank you, Dr. Ordessia Charran. Thanks to the outstanding public relations team at KRMC, and a big shout out to Julia Walters-Kowalska, who introduced me to Kim and Phil. And most of all, thank you to Kim and Phil Kostka. Patient privacy laws are important, but in most cases, they mean no one will hear a story like yours. We're so pleased that you've chosen to share your experience. And Kim, that you're here to share that experience. I'm TG LaFredo, and thank you for listening. Stay healthy, and we'll catch you next time.